Okay, I think we can get started. So hello everybody. It's great to see you all here today, and we're very excited to welcome some of the staff from Nottinghamshire Healthcare Foundation Trust. They're coming to us from the Intellectual and Developmental Disabilities Service, and we've got a wonderful project for you to hear about. So I'm going to let them introduce themselves. Kathy, I don't know whether you want to unmute first and introduce yourself.
Yeah, hi, I've just put it down in the chat as well. I'm Kathy Brown. I'm an occupational therapist in the Intellectual Developmental and Disability team, and I'm based over at Newark and cover Bassett Law as well, Newark and Sherwood Bassett Law. I think
Vicky, do you want to go next?
Oh. Yeah, I can do, but I just saw that Stella had arrived.
Oh, so. Fab. Excellent.
Yeah. Sorry, I was a bit late. Mum taxi. I'm Stella. I'm a speech and language therapist. I work with Kathy in the community learning disability team in Newark.
Fabulous. Thanks, Stella.
Shall I come in, Lisa?
Yeah, go for it.
Hello, everybody. I'm Vicky Romilly. I work in Nottinghamshire with Stella and Kathy. I'm a speech and language therapist by background, and I'm currently on a national trainee consultant programme. That's not the aim for today, but I'm going to put the competency framework in the chat for you all. As AHPs, it can be a hard route to get to consultant level practice. We don't necessarily have really clear career frameworks. I've been working in my field for 26 years. But please do have a look at the competency framework. For my colleagues here that are students, for my colleagues here that are band fives, have a look at that competency framework and think about impact longer term. I'll put it in the chat.
Thank you, Vicky. That's really important. You're right, to think about how your career can develop and those pathways. So thank you for sharing that. That's fantastic. I'm trying to think, do we need to introduce anybody else? I'm just mindful that I don't have everybody on this first page of my screen. So Liz, do you want to introduce yourself as well, because you're part of the project?
Hi all. Yeah, my name is Liz Fletcher. I'm an occupational therapist and work at Sport for Confidence, and I have been involved in this project they're going to talk to about tonight. Hello everyone.
Thanks, Liz. I'm wondering, Kathy, if we want to get started with the slides. I know Kathy's worked hard on some fab slides for us.
Let's hope I can share them okay. Window, no screen. Let's go for screen. Right, can you see that first slide okay?
Yeah.
Fabulous. Okay, so Stella, do you want me to start off at the moment, or because you were the one who sort of did a lot of the work at the beginning?
Yeah, no, you're good, Kathy. It's you've done all the work on this as well on the presentation. So yeah, you go.
Okay, so Vicky's introduced herself, Stella's introduced herself. So Sarah Needham is our physiotherapist who's also part of the project that we've been doing and also continuing on the boccia group. And myself and Anne Skipper, another OT who's also been part of the project as well. So if I just click for the next slide, there we go. Right, well, the idea, and I think really Stella needs to take the credit for that, was because you started off, didn't you, saying about a discussion between the AHPs on activity groups in Newark for people with an intellectual developmental disability, particularly after the pandemic, the COVID pandemic. So somehow around this time, we also visited the new YMCA in Newark and had a look round. Like I say, Stella really took the lead, and we also approached the NHS Day Centre in Newark and the staff nurse Jay Griffin Bedlingham, and she was very keen to have people come and join the boccia group. And I think, I can't remember where we came from. Boccia, Stella, where did the idea for boccia actually start? Or was it because Liz Fletcher,
Yeah,
Liz came on board as well? And I think they'd done a project down south in Essex, and she brought up the idea about boccia, because I must admit I hadn't actually heard of boccia before then. So moving the idea on, that was with support, a lot of support from Liz from Sports for Confidence, Zoe, and initially then Nathaniel at the YMCA. They both worked there, managers there. We also had Boccia England and an amazing gentleman called Pete, who was really good at moving us on and looking at boccia from a sort of more professional scale, I suppose. And then obviously Jay from the day centre, and she helped to identify people to attend the group. And then we had to obviously just check with our team leaders and clinical director to make sure that was okay and doable and fitting it in with the rest of our commitments for the trust service. So aims of the group. This was to provide people with an IDD a physical activity group to engage and participate in their local community. So all the people who attended the day centre also lived very close to Newark or in Newark. The physical activity group as well was important because there aren't always very many opportunities for physical activity, and we felt that would improve participants' general physical and their mental health as part of that. So again, promoting self-management, socialisation, communication opportunities with purposeful movement and meaningful activity. And to start off, we thought, right, we're going to do a pilot of 12 sessions. And fortunately, we got YMCA on board as well, and we were able to carry them out there. So it all looked really good. And now, Vicky, I don't know if you want to go on this, because I think the idea of the physical part, having physical opportunities in the community is just a really, really important thing for our client group, because they really, they can't always access these things very easily. So Vicky, I don't know if you want
Shall I pick up for a couple of slides then? Yeah. Okay, so this might look, first of all, like it's slightly separate and slightly theoretical in comparison to the kind of real practicalities of thinking about rolling out a group. But I think I've seen lots and lots of colleagues join today that either work in the health service or potentially plan to work in the health service. And we work at the moment in a system that is under a huge amount of pressure. And I'm not sure that while we might focus, understandably, on how people wait well whilst they're on a waiting list, I'm not sure that we've got the capacity to meet need. And so there's something about how can you, in listening to Kathy and Stella and colleagues' projects, how can you phrase the idea of thinking about working differently and why we work differently? Alongside that, when you think about a lot of our work as AHPs is about instilling positive health outcomes through behaviour change. And behaviour change might be with an individual, behaviour change might be within an individual's support network. And I think that in my role at the time as clinical director, when I was listening to Stella, when I was listening to Kathy, and from my own history of working in community learning disability teams a long time ago, quite often we're in situations where we're unsure about the effectiveness. We understand rationale, we understand evidence, but we're unsure about effectiveness. And thinking about connecting your own self, your own lifestyle, to thinking about the people that you support is really, really important. And so in a different way, what I'm really talking about is recognising population need, recognising the broader, wider determinants of health for the population that you're supporting. We're supporting people with an intellectual disability in this project, but thinking about the population that you support, thinking about what we might know on an individual level about people's health behaviours, how people's lives impact on their health behaviours, and thinking about people's communities, where they live, what opportunities people have access to. I really think, when I think about this, I really think about a chap that I worked with for a very, very long time. And he, I worked with him in secure care. He was a chap with mild intellectual disability. And he had a real focus and was really supported by our OTs brilliantly in secure care, and had a real focus on discharge, that he would go to the gym all of the time. And his reality was that he didn't go to the gym. He didn't go to the gym. It was too hard. For me as a speech and language therapist, there's huge connectivity between thinking about how people are accepted as part of their community, how people engage with their community, how their community learns and builds confidence to engage with somebody with an intellectual disability, and people being part of the society that they belong to. But there's a potential, and I recognise I'm here with colleagues from Sports for Confidence, that there's a potential that as AHPs we have a huge role to play in that, but that perhaps sometimes sits quite separately and differently from our very, very traditional ways of working, accepting a referral, undertaking assessment, providing individualised support to somebody in their home. And I really, really wanted to listen to Stella. I really, really wanted to listen to Kathy and colleagues about their ambitions to work differently. But what we have to do is we have to demonstrate to other people, why is it important that we try working differently? And understanding the populations that you support, having some data to help you think about population, both in terms of potentially data from something like a joint strategic needs assessment, but also your local data from the local service that you belong to is really, really important. So want you just to be aware, if you're not already, and I'm aware that some colleagues might be, of the King's Fund approach to population health, and just want to share a couple of slides on my learning and how that's helped me feel really confident to think about how we support and encourage very, very different ways of working. So shall we move on to the next slide? But I think some of this still fits. Okay, so I think within the notes that you will have the link for this framework, and forgive me if this is something that you've talked about a lot before, but there's a really, really useful tool produced from the King's Fund about how AHPs can, on a very individual level, be really thinking about population health and population planning. So the idea of getting things right for ourselves, getting the basics right with people, how we provide care for individuals, how that fits in with our clinical teams. And I think what you're going to hear from Kathy in a bit is really about how we start to fit our pathway around our communities and people that we support, and how we start then to influence our system as a whole. So my small role in this is coming from a point of view and thinking about health inequalities and population, and ensuring that our commissioners are aware that this is a piece of work that we're trialling. This is something we're scoping. This is something that we want to build an evidence on to demonstrate how we want to work differently. And I just want to share a couple of quotes to you. So as part of my consultant pathway, I undertook the Leadership in Population Health course at the King's Fund, and was privileged to spend a little bit of time listening to Chris Bentley. And sometimes I think in the past I've kind of been overwhelmed by the idea of population planning. But when I listen to Chris Bentley saying, these don't occur randomly or by chance, and you will know what health inequality is. You will know it. And I'm quite sure that you, or within your area of work, will think about the people that you're supporting and think, yes, I understand what health inequalities are. And his viewpoint was, you need to wrap around people at the highest level with the highest risk, and that starts to influence population inequalities over time. So if we move on, I think I've got one more small slide, which again is about the system that you work within. So in this triangle, the system, lots of us who work in health or social care environment or voluntary sector equally, part of local authority, part of an integrated care system. The reality about that, you can just about see that there's one big triangle, but there's the pink coloured triangle with a red line going around it. Thank you, that's helpful. And Chris Bentley's viewpoint when he shared with us was, that's the reality sometimes of an integrated care system. And how do we build on that? How do we build? So we're thinking about the civic level, the local authority level, the community level interventions. And what's our role from a health point of view in that, or from a health professional's point of view in that? So our ambition is to grow the triangle. That absolutely makes sense to me. But another thing that makes sense to me is the idea of climate. I know I'm going to sound like this is not connected, but it is. The idea of climate. And I think this is not something I'm expert in at all, but I think that with climate change, trees are changing. But I think that there is evidence that highlights that where trees are changing, they are looking after one another underground. And there is something about whatever area of work you work within, it's about reaching out and working in partnership. Because I'm quite sure that when my colleagues speak to you a little bit more about the project, actually there is partnership between Sports for Confidence, between the YMCA and the health service that is mutually stronger as a result. So let me leave you now to hear the detail of the project from Kathy and from Stella.
Thank you,
Thanks,
Vicky. That's
Kathy.
brilliant. Thank you. So again, this is very much with you as well, Stella, with the consideration, the practical considerations really of running a group. So first of all, it was the cost of the venue, which was going to be the YMCA. And also checking out accessible facilities, because we had two people in wheelchairs and also other people whose mobility isn't great enough to be able to walk up a flight of stairs. So it was checking out the stairs. There is a lift there as well. The toilets are accessible. There's also a lovely cafe there as well. So there's drinks. There's also water fountains dotted around as well. And just generally the environment as a whole, it's got big wide doors for accessibility. It's been thought out really well. There's also the cost of the YMCA instructor, and then also the cost to the people attending the group. You know, is it going to be too much for them? You know, unfortunately, we couldn't provide it for free, but because there were costs entailed. And then another cost was the transport to the YMCA. So going on from there, we had more considerations, was the cost of the boccia equipment, because it is quite specialised equipment. The cost of perhaps support staff required during the transport and in the sessions as well. And then again, the disabled facilities for people and the dates and availability of the actual venue and of the instructor. So the pilot group at the YMCA, we managed to consider all these things, and it was to carry out a pilot group of 12 sessions. The date to start, I think we might have, what was it, Stella? We had about 2 start dates, I think, so it had to be put back twice, which was really unfortunate. But it was more around the availability of the instructor and the building as well, wasn't it? And then just making sure we were about the cost as well. Then, so finally we started the 12 sessions, and we also wanted to evaluate it as well as best we could. And fortunately, and this was with Pete from Boccia England, we were able to access some free boccia training, and that was open to all people, sort of the AHPs ourselves, and then the YMCA staff, but also the carers that came. There's MenCap, Reach, and also the YMCA staff and carers, so family members also came to that training as well. It was a really good occasion, that was. And then also we got the agreement that we could continue the group. So we're about to start the next session tomorrow, in fact. So from an occupational therapy point of view, we're looking at outcomes, and myself and Anne thought about it and thought we'd give the volitional questionnaire from MOHO, Model of Human Occupation, a go, which suited it really well. Though it's a volitional questionnaire, it's actually very much an observation tool. So you sort of observe people and then fill it out afterwards. So there's the VQ items, and it's all around a continuum of change of the person while they're going in the groups and over a period of time. And it's looking at mainly motivation, not at their skill competency, if that makes sense. So it's not how well they're playing boccia, it's more about their motivation to engage in it. So the continuum of change for the VQ, it looks at exploration. So when they start off, then as they get more competent, how does the motivation change? And then if they, get achievement, and I'll just go into a little bit more detail about that. So exploration is just about trying new things, having a go, making an attempt, initiating the action without the carer or a member of staff sort of starting it off for them, showing preferences, and also perhaps showing that the activity is special or significant. And that was quite interesting with the day centre people that came to the group, because they had all actually played boccia before, so they were probably starting at a little bit of a better level than I was even. So then going to competency, they took a few sessions, to be fair, but I think because it was a different environment and obviously there was a new instructor as well, it took a few sessions to get going, but they definitely showed a lot more initiation of the, going up and collecting the balls, knowing where they were. And so I would say the competency did happen within those 12 sessions, with problem solving a bit, getting engaged, showing some pride when they won, correcting themselves a little bit on mistakes and doing a bit of a better throw later. And they obviously wanted to win as well, though that came through really well too. So achievement, this is where they pursue the activity completion, accomplishment, seek challenges, invest additional energy, emotion and attention, and seek additional responsibilities. So why boccia was such a good activity to use with them is that everybody, no matter what their disability, were able to have a go at doing this, to seek a bit of a challenge. Some people perhaps didn't quite get to the achievement, but there were definitely other people that did. They definitely invested a lot of energy and emotion, but they also shared with their colleagues. They shared and picked up ball for people who weren't as quick at picking up the balls, and the additional responsibilities. We used to have a team captain, and there were a few people that were quite keen to take that role on as well. So the next slide, Stella, is speech and language, which I don't know if you'd like to take on from there. Thank you.
So from a speech and language therapy point of view, it was really lovely to work with a group where it was really, really functional, but also the communication was just really lovely, because the staff and the service users were often kind of learning new skills together. So it was like real genuine communication opportunities, rather than something where perhaps the staff have done it lots and lots of times and the service users, are perhaps new to it, because we were kind of all at a level playing field almost. All service users were better than us, I think, Kathy, weren't they?
Yeah, definitely.
So that was really lovely to see that. But from our point of view, we tried to make the accessible information available before the group to sort of remove any worries or concerns about coming to the group in the first place. So we did some social stories around what to expect and what is boccia and how you play boccia. So they were all circulated before the group started, so that people had sort of had any worries about that removed. So I think that was useful, and obviously we've got all these resources for this time. So once we've done them for the initial pilot, then we've got a little bank of resources that we can share and reuse. We did a little bit of informal training in the setting around good communication skills, because at the YMCA they hadn't worked with our client group before, so we thought it'd be reassuring for them to just talk through things like roughly what to expect in terms of communication levels, and some really key signs, Makaton signs for actually playing the boccia, and then just really key skills like using simple language, using repetition, rephrasing if you think somebody hasn't understood. So we just had a really short session around that. And then within the sessions, we sort of tried to promote the total communication environment. So all our service users were at different levels. So it was about all forms of communication are really welcome and embraced. So verbal communication, people that using gestures, signs, and then we also sort of introduced partway through a Big Mac for somebody who was non-verbal, so using a switch with a recorded message. So just embracing that as a whole environment and trying to sort of combine it all as one environment rather than individuals using different skills. So Some of the verbal service users would have a go on the Big Mac, things like that. So it was just sort of trying to get that really positive setting. And then and the group kind of evolved as it went along. I think it's fair to say, Kathy, do you, during the 12 weeks. So after a few weeks, we decided it'd be really nice to have some more resources during the session. So we created a visual score chart, which was very much to involve the service users during the session in doing the score chart. So when they scored a point, they put their own point on the chart. At the end of each game, we showed it. And actually, by the end, they were all really keen to see what the chart was and which team had won, and they were getting really competitive about it. But you know, they really embraced that as being part of the session. And they also would like direct you if you'd gone to the wrong service user, to say actually it was their point, they should put the point on, which was lovely. So that peer communication was really nice to see as well, which sometimes I think you don't always see peers communicating with each other, whereas they will communicate with staff. So then we also tried to make the service user feedback accessible. So we set it up on an iPad and we just had 3 faces so people could just tap how they'd felt about the session. So sort of happy, okay, didn't like it. And we started off really well with that. But I think a learning point for the next group was the iPad came with the Holly Lodge staff, but actually we really needed our own iPad because sometimes they forgot the iPad, or sometimes we forgot to remind people, or you know. So I think that's something that we should, you know, I felt perhaps I could have taken more ownership of for another time. And then I think, oh, sorry, I've gone on to the next slide, Kathy.
That's all right. That's right. There you go. There you go.
Just rambling away as usual. Where have I got to? So yeah, and then I think it was really nice to feel that we were sort of building confidence with partners at the YMCA who were completely new to our client group in communicating with our service users. And I think that felt really valuable in terms of one of the aims of them perhaps going on to set up further groups, but perhaps with either less support or no support from us. They'd got that bit more confidence, and it had removed a bit of the barrier, I think, that sometimes people have if they're not familiar with our service users. And then personally, I felt from my point of view, and I don't know whether you'd agree, Kathy, but it was really nice to work with the MDT and all have that shared aim for the group, and to just all work together on it with the same group of people. Whereas often we might work together with individuals, but we haven't really had a lot of opportunity to work together in a group, and definitely not in the community. So I thought that was really valuable.
No, it was very valuable. It was really good, wasn't it? I think we've just got a few of your the resources there that you used.
Yeah, so this was one of the social stories. Obviously, it was a little bit of a booklet form, but yeah, it was just using photos, and actually we've done like a generic template as well, so in the future we can replace the specific things like the picture of the building and the exact minibus, and then obviously a lot of it will be able to stay the same. But yeah, it's really easy to tailor it for future groups, for us or for any other people actually doing similar things. And then we put our faces on the end just so that people yeah, knew who to expect when they arrived. And we tried to meet people at reception before they came in. And actually Nathaniel really took the lead with that, which was lovely because he is obviously employed at the YMCA and he's the coach. So he went down and met the service users every week, and have to say they all really love him, don't they?
They do.
Yeah,
As we all do, I think.
Yeah, absolutely. Yeah. So I think you know, they are really. I think he's really enjoyed the client group as well. So I think he's definitely looking forward to the future as to other things he can do to work with our service users.
And it's lovely because there's so many other things in the YMCA that they seem to be able to have access to by realizing that it's there, I think, isn't it? And Pete was really good at the beginning as well, from Boccia England. He really got us focusing on boccia as a sport and how to play it properly and everything. And because he brought the boccia tape to mark out the court, didn't he, and everything. So
yeah,
that'd been really good.
And although we have to confess that we did not play strict boccia, did we? We, as the weeks went by, we got more and more inventive.
I tell you what, though, we started getting the tape measure out at the end and measuring how, because the balls had all got so close on both teams, we were having to measure it with a tape measure.
Yeah, and it was really interesting because towards the beginning of the sessions, we'd say to some of the service users, if it was really close, would you like to come up and have a look? And, what do you think? And they didn't really want to come and do it. But by the end, they were like watching the millimeters, weren't they?
It got very competitive towards the end, didn't it, really? And then there's the physiotherapy, isn't there? So sorry that Sarah can't be here today, but I think she's only just come back from annual leave, a long annual leave. So, but from physio point of view, it's really good for maximising opportunities to see people moving, and getting people moving in the sessions, because you've got to move. It is a physical activity. It can be adapted for people in wheelchairs, but equally, there's nothing stopping them moving around as well to pick up balls and get help with that sort of thing. And also it advising on abilities and building on the skills of people as well. But it is lovely to see people being so physical as well.
Definitely.
So outcome measures was attendance. We've made a note of attendance. That's always very important for a first group and for the 12 sessions. Observations, because we made notes every week, just see how people got on. There was obviously the iPad, like Stella mentioned earlier, with there was one for the service users, and also carer surveys went out as well, didn't they? And then as a team, I think we all used the East Kent Outcome Survey, which is ECOS, which we use on our clinical system, Rio. And then as an extra, the OTs actually filled in the volitional questionnaire. So there we go, the results of evaluation. I think it was a really positive group, as we've just been saying. It was a noticeable improvement of everybody as the weeks went on. It improved physical and mental health. The community environment enabled people to be more social. They definitely did. Everybody, it was much more fun, lots more laughing, and also I think encouraging each other and clapping and cheering for each other. And then Boccia England training for all, which that worked really well. And we've been given the go ahead to carry on. So like I say, we've got another 12 sessions starting from tomorrow, and fitting around when the YMCA can have us. So school holidays, that's their busy time because all the children come in then. So we don't actually run the groups in that period. But no, so I think we're sorted until next year anyway, aren't we, Stella?
Yeah, definitely. Yeah. And just to add as well, just going back to the YMCA, I think we timed it really well because the YMCA was a new build at the point where we first approached them. So that was one of the reasons why we approached them specifically in the first place, because we wanted to try and build some rapport with them and get some sort of relationships right at the beginning, sort of to embed that into their thinking of who they were going to be offering to in terms of the population. We really wanted our service users to be represented at the YMCA.
And Nathaniel's been so good and so enthusiastic, and he's just been so good with the client group as well, hasn't he? We couldn't, have a better instructor, really.
Absolutely, yeah.
And I think that help, that support from YMCA has made it possible. And also, of course, the day centre as well. They were very supportive because they provided transport and the carers for everybody. So it's going to be interesting this next session because we're not relying quite so much on the day centre. We're getting other people coming in with their carers or with parents. So it's going to be, again, another learning curve, I think, for the next few sessions to see how that works out. So do I play the video? Should I play the video, Stella? Have we got time to play the video?
Yeah, absolutely. Go
Is that
for it.
all right? Are you okay,
Yeah.
Stella, with that?
Yeah,
I
absolutely.
think,
Yeah.
I think both of these are links to the video, so it's the same thing. So if this works, let's hope you can hear it and everything. And this was a video that was made by the Trust for showing it off. Can you see that, everybody?
Yeah, we can see Andy.
Hello, my name's Sarah.
Can you hear it?
I'm one of the physiotherapists.
Hi, I'm Stella. I'm a speech and language therapist.
Hello, I'm Kathy Brown and I'm an occupational therapist.
And we work for Nottinghamshire Healthcare NHS Foundation Trust.
And we work in the specialist services of community, intellectual, developmental disability service.
So the reason that we wanted to start this project was because we wanted to be able to offer our service users something in the community, and we didn't really feel there was an opportunity for us to refer them into. So we got together to see could we help facilitate a project.
We're really keen to facilitate a sport or physical activity group for our service users within their local community.
The partnership was also with Botcher England, a gentleman called Pete who's been brilliant, and also day services at Nottinghamshire Healthcare Trust also wanted to be involved, and their people that attended their day services have come to the group, which has been brilliant.
The ways in which I feel like physiotherapy has helped is because I'm able to kind of tweak the exercises and the activities so that it's inclusive for them. And other ways that I didn't expect initially that will be beneficial is that they're all using the stairs to get up, their balance has improved picking the bocce balls up, just transitions, getting on and off the chairs, which has just been amazing to see their confidence grow.
From a speech and language therapy perspective, I was really keen to make the environment a total communication environment so that all methods of communication would be used and valued, and we could support that. And also a lot of work went into the preparation with accessible resources to make sure service users were comfortable coming to the group initially and well prepared.
And from an occupational therapist point of view, the Botcher is a really adaptable group activity for lots of different people, meets lots of different needs. So we've had quite a diverse section of people with different disabilities within the group. And things, for example, like a ramp, and that's helped with hand dexterity and things, and enabled them to throw the ball or for the ball to go further without having to throw it. And we've also looked at their motivation as well, and how that's actually improved over all the sessions. And how much enjoyment and the camaraderie between everybody, and the fact that they will pick up balls for each other. It's been a really good opportunity in a different environment, like Stella was saying, for this group to happen for them.
At the YMCA, we are all about community and trying to provide opportunities for those that don't necessarily have access to these types of facilities, but also helping people to belong, contribute and ultimately thrive, and that's kind of why we wanted to get involved in this project. I've loved working with the people. The people are absolutely incredible. They play lots of different games, and we have nice, like we warm up with the YMCA song, and it's just really great and fun, and just to see like the level of growth as well and change. Working with a variety of different stakeholders and working with the NHS, it's given us that kind of confidence to be able to work with this type of population. We probably wouldn't have done this project without the support of the NHS, so having the NHS there and involved, it just gives us that level of confidence to be able to provide this type of service. That's been a really important and key part of this project.
My name is Liz Fletcher. I'm an occupational therapist and work for an organisation called Sport for Confidence. Sport for Confidence has a delivery site based in Essex where we use the expertise of occupational therapists and sports coaches, mainly based in leisure centres but in community spaces too. Sport for Confidence are a Sport England system partner, and so what that means is we're trying to elevate the work that Sport for Confidence does locally but on a national level, and so which led me to working with Notts Healthcare NHS to start working with the AHP groups and how we could devise a physical activity based group and to try and get more service users, people with learning disabilities into sport and physical activity. I've been really impressed with how Notts Healthcare have really started to work in partnerships with other organisations, and it's also really important to know about your active partnerships. There's about 26 or 27 active partnerships across the country, and in Nottingham there's active knots, and I think it's just important for healthcare professionals to know about their active partnerships, because they are the first contact point really for anything physical activity related.
The project so far has gone amazing, and it's just we really feel like it's a viable way that we can refer patients into, so that we're not just seeing them individually at home, but we can get them together and treat them as a group, so that it's more meaningful to them and they're more likely to carry it on.
We're really positive about all the benefits to our service users' well-being, and it's the partnership working that's enabled us to run the group and been key to the success of the group.
So I think our final message would just be to any healthcare professionals that are thinking about, could we do this for our service users or the patients that they're working with? We can't recommend it enough. We've absolutely loved it, haven't we? And please, get in touch with us if you've got any questions. If we can do it, then so can you.
Okay. I think and that was it, I think, wasn't it? So
Yeah.
any questions?
Can I just say as well too that Liz gave us so much support in the beginning and all the way through really, but definitely guided us massively, and that's why the group got to where it is really. So yeah, thanks Liz.
Yeah. Thank you, Liz.
Thank you so much for your presentation as well, Kathy, Vicky and Stella. And Liz, I wonder if you just want to say a little bit about your kind of role in that, and then we can go to some questions. I can see there's a few questions in the chat.
Hi all, great presentation. I just think it's brilliant work, and thanks for giving me some credit, Stella, but it wouldn't have happened. I did actually sit back and do a reflective piece, which I haven't actually done anything with yet, but I just sat back and thought about what goes into creating a project like this, and you'd want it to be simple, wouldn't you? But actually it isn't. And I think I've been having conversations with the AHP leads in Notts NHS Trust for quite some time, and actually, give credit to a few other people that aren't here now, like Vicky and her partner. She's a manager, a speech therapist as well, Heidi. I think there's certain leaders in the trust that have had to really fight the corner to make this group, one, happen, and two, sustain. And I think we do need leaders in trusts to enable people like us as OTs and other AHPs to do what we know we can do. I think on the one level, this group should just be normal. We know we've got the skills to do it. We know we've got the ideas, and I think there's a few students here on the call. We've got that enthusiasm, but often we are worn down by the lack of resources and the problems that exist within healthcare. So we do need special people to come in and fight our corner and make stuff like this happen, and we need it more and more. And I think I would be willing, and I think there'd be other people on this call now that would be willing to advise and support other initiatives like this. So just let us know and contact us. You've got Lisa's details, and we will be there to support you or cheer you on.
Thanks, Liz. And absolutely, we love to hear about all of the different projects that people are interested in setting up. And I can see in the comments there's lots of, I'd love this to come to my area. And I think Kathy, Vicky and Stella have kind of spoken to the fact that you can make it happen in your area, but it's about, as Vicky said, justifying that as well, gathering the right data. It's great, that the team will work together to kind of drive this forward. So there's something there around finding your people, whether that's within your own team, but also, as Liz said, people in leadership positions who are happy to support and will kind of speak further up the chain about how important this is as well. So we're always happy to support with these kind of projects. So do feel free to reach out to us. I know we've got lots of questions. Does anybody want to be brave and unmute and ask a question, or I can pick from the chat?
I can unmute, but I've only just asked my question, so it seems a bit unfair. I just
Go for
wondered
it,
what
Lance.
kind of funding is needed, because if the participants are paying an amount to go, I wouldn't have thought it was that much to say how much social care and health spend on things. It's probably quite relatively small amounts, I would have thought.
Good question.
I think, I'll try and answer. I don't know if anybody else can. It's really tricky to say, actually, because the service users pay £3 a week each. But at the moment, for the last group, we only had 6 service users. I think typically if the YMCA were to rent out the room, if I remember rightly, Kathy, was it £60 per hour? So the YMCA, they'd got a pot of money that they'd got from elsewhere that they used to subsidise some of the costs, and also we applied for some funding from the NHS as well. So yeah, the costs weren't covered by the £3 a week, but the idea was we'd build up so that hopefully eventually it would cover it.
If we had more numbers, that would help as well, wouldn't it? Because there was also the cost of Nathaniel and his time as well, wasn't there?
That's it, yeah.
So yeah, so you'll have probably, well, I don't know, how did we get a costing for Nathaniel?
I don't think we did, no. I mean, it sounds awful, doesn't it? But yeah, it just
probably wouldn't be far off £100 for the hour though, would it?
Yeah, absolutely. And obviously that doesn't include the cost of our NHS time as well.
Yeah.
So that wasn't factored in as an additional cost. We were just really looking at the room really and the coach. Yeah. Vicky, sorry, I can see you.
No, it's okay. So I was just thinking about the money. So just for Lance, because I can see, Lance, that you're local too. So the money that we applied for was from the Learning Disability and Autism Partnership. And sometimes our systems have non-recurrent money, and non-recurrent money is a way of testing out. So I think I've seen something in the chat where somebody said, you know, how do you start? Start by testing out. Don't start with an aim to, I'm going to immediately sustain something. We need to keep on demonstrating. So now the project that we're going into now that Kathy and Stella just described is starting, did you say tomorrow? How exciting. So we applied for that money. But you're right, Lance, it's not a lot of money. And I can't remember off the top of my head, maybe it's about £1,500 that we've applied for from additional money from the system. But in terms of the health outcomes that you've heard colleagues describe today, it's not a huge amount of money. And in terms of the costs for people with a learning disability, because we've needed to be really clear, the health input is free at the point of access. People are requested and people can access a health service regardless. If people want to access the health service and undertake and engage in an activity at the YMCA at the same time, then they're paying for the activity. Does that sound clear, Kathy and Stella? Yeah.
Thank you, Vicky. Sarah, did you have a question as well?
Yes, I do. Just a quick one. How many people are you looking to get referred into your service, and kind of how many people? You might have mentioned this and I might have missed it, so I do apologise if I have. But how big is the group going to be of your service users?
I think, Stella, just we were hoping we could get about 12 this time, weren't we? We've got capacity for 12 in the room we're using, but I think hopefully we'll have at least between 6 and 8. We're not too sure until tomorrow. We'll let you.
Yeah.
So, but we'll hope maybe if we're lucky, we might get 10, mightn't we? I don't think we had the full 12 places sorted, but so we are hoping to have more numbers than the 12 weeks pilot one, aren't we? I think.
Yeah, absolutely. We tried to, sorry, just to add, we tried to do it a little bit differently for this session with the increased numbers, because we wanted to give the YMCA, so I don't know what the best way of putting it is really, but we thought it'd be quite nice if they built some of their own relationships, because they'd had a few inquiries from other people, such as an organisation called Reach, who have service users and had also come to the training. So the YMCA were going to try and have some of their service, their own relationship people, with a view to it not being completely dependent on health. But the way it's worked out, it hasn't quite worked out that way this time.
Mm.
And how do they refer in to your service? How do they? Is there like a way to a referral pathway?
So this time, because the original 6 came from Holly Lodge, which was the agreement, they were all from the day service. But this time, for the primary 6, we decided that each profession, each AAP would pick 2 people from their own caseloads that they would refer in themselves. So in the future, it might be that other people can refer in, but this time it's just been, we've had 2 speech, 2 OT, 2 physio.
That kind of links in. So, sorry, Sarah. And that kind of links in with Jack's question actually from the chat around, are there plans to expand the project into other areas, kind of specific to this geographical location, and what will be the route for referral? I think you've spoken a little bit to that. Are there any plans to expand?
Shall I pick up?
Yeah. Okay.
Yeah. Okay. Jack, I was thinking. I'm sorry. I don't think we know each other very well. I'm thinking you're local from your questions. So of course we would love to expand, but what we really need to do is to demonstrate. And I think that some of what Kathy and Stella just said now. So seeing the meetings, and Nathaniel couldn't come today, wanted to come but couldn't come today due to other commitments. But hearing that idea of, well, actually the YMCA are reaching out to other organisations and seeing in terms of an outcome that actually one of the senior colleagues within the YMCA is now starting to independently think about, well, how might we develop more accessible groups for people with a learning disability? What we want to do is to do ourselves out of a role within that potentially long term, and that's a huge outcome of a project. But I think, Jack, we've got a little way to go in terms of demonstrating my learning, and I'm learning all the time, but my learning is you build confidence in the system that you're working within. So it would be really big for us to suddenly go, let's absolutely change our pathways. We're commissioned to provide very specific pathways. We need ways of demonstrating that we can do that through very different models of working. So we're hopeful now in this next stage that we're going to evaluate, and we're going to evaluate more about understanding the relationships between different partners and what's beneficial about that, how that adds to outcomes, and what we need to learn from that. So that's our next stage.
Thank you. That was a really comprehensive answer, Krishna.
Thank you both. I can see that Lucy's got her hand up. Lucy, do you have a question as well?
Yeah, I do. This might maybe not be applicable to you guys, but I was wondering how you actually advertise the group. Like, we talk a lot about like interest checklists and stuff, and if you're working with people with sort of intellectual disabilities, like I think even sort of in the mainstream, like botcher's quite a new thing, and it doesn't, like, the word botcher doesn't really mean anything. Like, I was wondering how you sort of explained it to people before they sort of came to the group, if that makes sense.
Well, Stella, you've done all the accessible information, haven't you? So that was really useful, I think.
Yeah, so we did some social stories around what botcher is. I mean, I'd never heard of it. I was learning as I went along, really. So yeah, we did the social stories around what it actually is. Really, really basic. You have red balls and blue balls, and you throw it at the white ball, and you can sit down to play or you can stand up to play. So in terms of explaining it, we did that way, but we also did a little poster, and we knew last time that it was only going to be people from Holly Lodge, it's called, that were coming, but we did a poster specifically for Holly Lodge so that they could put that up on their notice board. So the service users that were coming would see it, but actually other people would be aware of it as well. And just as an aside to that, actually we've had a little poster that's been sent to us from Botcher England this week. I don't know whether anybody else has seen it, but they, in Nottinghamshire, if anybody is local, they're doing a taster day without wanting to advertise it for them, for any service users with a disability that can just do a drop in. And I think it's from something like 10 to 4 or something. But yeah, so I think they're obviously advertising that as well. But yeah, we haven't advertised it wider than that, but we have got those resources to use in the future.
Yeah. And we've got our promotional video now as well.
No, it's a fantastic resource. Very professionally done. I love it. I've just seen in the chat as well that Lauren had been asking about, are there any community boccia groups which might be available in other areas? And I'm wondering whether Boccia England might be a good source of information to signpost Lauren to for that and others.
They've definitely got an active group at Reneth in locally anyway. So in not, over near Mansfield. So
it just depends what's available in that local area, but I think probably through Boccia England's website would be a good place to start for now. Martin, I can see you've got your hand up.
Hi, yeah, I'm a student from Teesside University. I was just wondering, when you were talking about demonstrating like the success of the project, is that sort of like your outcome measures that you would use to demonstrate that if you were trying to roll it out further? Or
good question. I suppose what data were you collecting to kind of justify the need for it and the ability for it to carry on? That's a really good question.
I think, Stella, do you want me to pick up, or you go, Stella? Go for it.
Well, I was just going to say, Vicky, that kind of ties into the evaluation that we've been starting with you, doesn't it? The realism. So yeah, should I let you?
So I think, Martin, and I shared at the start that I'm on a trainee consultant pathway at the moment, and through that pathway, I've been really guided to learn about an approach, a research approach called realism. I didn't know anything about realism before, but realism is a way of helping you understand complexity. And some of my national guides have guided me to think about, how do you get to the murky lowlands of the reality that you work within? And so I think you've heard from Kathy and Stella about the outcome, the actual outcome measures that they've used for individuals, the feedback that they've gathered. So we feel that we have some of that already. But what we want to do now as a next stage is to really understand the complexity of partnership working, people's viewpoints about partnership working. So we've developed something. So when you use realism, if you're using realism with your own primary data, you start with an idea called a program theory. And you shape your program theory both with evidence, with grey literature, but also with the experience that you bring. The experience that you bring and you kind of know already. And then you use that initial program theory and you revise your program theory according to the data that you see coming out. The data that you see coming out is broken down into the idea of something called context. So what is the context in which something happens? What is the mechanism that either then enables that to happen or not? And what are the outcomes that you see? So what we've signed up to next is starting to think about a service evaluation where we're where we interview colleagues that are directly involved in the project, so the partners, to learn about partnership working together. I hope that provides you with an answer. And certainly I'm at an early stage of learning about realism.
It's the first time I've heard that phrase used like that, but yeah, it has.
Fantastic, thank you. I'm very aware that we've gone slightly over in terms of our time. Liz or Sam, do you have any kind of closing thoughts? Because I can see you've both got your hands up, and whether you've got any kind of closing thoughts for us.
Well, I would like to stay on until 9 o'clock tonight. Actually, I've got nothing better to do.
We could chat all night.
I'm quite comfy on the sofa.
I've got lots of questions written down.
It always feels like like it's the end of the working day, 5 o'clock. It's kind of like the last thing you want to click on and do, but it's been very interesting. So I've loved being here. But I actually just wanted to answer, I think it might have been Sarah's question. She said about how did you explain boccia? And I just wanted to sort of point out from a sport for confidence sort of lens, we have lots of different sports. And so although it is important, and that kind of work that you did, Stella, beforehand around introducing boccia, I think is brilliant. So I'm definitely not saying that that's not important, but I'd also say it's like any other OT initial assessment. And if you were going to any other group, it's actually how would you prepare somebody for not just the activity, but the environment and what they would, what they should expect. And so often I would say, people come and test stuff out, or it's like getting through the door, sometimes to the leisure centre. That's the important thing rather than the sport itself. And so we have to remind ourselves as OTs working in this area that sport is important, but it's a one part of the pie, one segment of the pie.
Absolutely. That is a really important thing to remember around, it being potentially about just accessing the community at that point. And yes, it's about physical activity, but is it more just about people getting out and about, being part of their community, that sense of belonging as well? So those are all really important things for us to consider. For us, it might seem like a small thing to come to a leisure centre, but for some people, actually, that's a massive thing and something that's completely outside of their comfort zone. Thank you, everybody. I could stay and chat all night, but I want to let you go and have some of your evening back. But thank you all for coming along today. There we go, just stop the recording.